According to the World Health Organization's Africa office, COVID-19 was slower to reach the continent, but infections have grown exponentially in recent weeks. Africa already has expertise in fighting viral outbreaks, and Africans experienced lockdown procedures during previous outbreaks of Ebola and the Marburg virus. How could China and South Africa work together to battle COVID-19? For a special broadcast, Sophie Mokena from SABC will be co-hosting Dialogue with the World, explore these issues of concern with experts from China and South Africa.
Yes, indeed, China and Africa has strong multilateral relations, and the cooperation moves beyond the political and economic partnerships. In times of crisis, the continent and China have each other's assistance. And with this global pandemic, it has been no different. When the epicenter of the coronavirus was still in Wuhan, China, South Africa lended assistance by sending medical PPEs. And now that the virus has moved across the world, China is returning that favor.
And from China, we're joined by Dr. Gao Fu, the head of the Chinese Center for Disease Control and Prevention. Dr. Gao led China's mobile laboratory testing team during Sierra Leone's Ebola outbreak in 2014, and since then, he has continued to lead the CDC's efforts to strengthen public health security in Africa. And
joining us from Pretoria, Health Department's Deputy Director General, Dr. Jürgen Pillay. He is responsible for policy making, implementation, and monitoring of national programs in HIV and TB, as well as women and child health. Dr. Pillay is currently facilitating the re-engineering of South Africa's primary healthcare system. Thank you, Dr. Pillay and Dr. Gao, for being part of our dual broadcast.
Let me start with Dr. Pillay. As of April the 20th, 120,000 rather tests have been conducted in South Africa. While the WHO has said the testing and tracing context is essential, but how is Africa scaling up the testing in a country with more than 50 million people?
Thank you very much for the opportunity, and good evening to people in China, and good afternoon to people in South Africa. Yes, indeed, we've done around 120,000 tests so far, and the intention is to scale up. One of the things we've done in the last 2 weeks is to send out community health workers to each of our districts, especially those that are considered vulnerable and where we think there are new infections. And they have screened more than 2 million people and referred more than 16,000 people for testing. We have the results now of an additional almost 7,000 people who have been tested from communities. This is in addition to people who pitch up at doctors' rooms and clinics asking to be tested because they are not feeling well. So indeed, South Africa is ramping up tests. We would like to move quite quickly to test more than 10,000 people every day in South Africa, because we think that by testing people, finding out who's positive, isolating them, we will be able to then eliminate the small fires where there are small pockets of the virus and therefore prevent its spread.
And I know that your country is still in lockdown. How would you predict COVID-19 will develop in South Africa?
So we're in our 4th week of the lockdown, and we have another week to go. And I must say, led by our president, the country really is trying quite hard to ensure that people adhere to the conditions under lockdown, and that we start thinking about how we ease the lockdown so that we can return to work and that children can return to school. But as it was in Wuhan and in other cities in China, we think that the lockdown is critical to both prevent new infections, reduce deaths, as well as ensure that especially the elderly and people with comorbidities, other health conditions, are prevented from getting the virus. So we think that this is the right decision to do, and really we borrowed the idea from China, and we saw that the Chinese experience with the lockdown was very successful, and hence we also, the president decided that this was something we should do as well. So we've learned some lessons from China already.
Let me come in. Dr. Gao, you were on the front lines of the Ebola in 2014. The outbreak was experienced in countries such as the DRC. In terms of your knowledge of Africa's capacity to deal with infectious diseases, how do you think Africa's experience of battling previous infectious diseases or the outbreaks can help the continent to deal with this current outbreak or the pandemic, COVID-19?
Good afternoon and good evening, everybody. Hi, Dr. Sophie Mokena, Dr. Pillay, and it's nice to meet you here. In my opinion, because I visited Africa quite often for the last decades, since especially in 2014, I was in Sierra Leone. I worked together with my colleagues in Sierra Leone and also my Chinese colleagues there. I believe, I'm quite confident. The Africa people and you guys are very, I think you guys, very experienced for fighting against those emerging and re-emerging viruses, including, Ebola and also, Lassa fever. You experience so many viruses there, especially in South Africa. I mean, your capacity and the facility are quite good, in my opinion. So you will, gain something from your experience, from your facility and capacity there for the last decade you built up. Think about it in China at the moment. As Dr. Pillay said, you want to pick up some experience from China. So actually, we did something from the very beginning. We have two battlefields. I call it two battlefields. One battlefield in Wuhan and Hubei province. That is a lockdown strategy. We also have some the rest of the China, except for Wuhan and Hubei. So there, we just, relatively, it's kind of, you can call it a lockdown, but more or less it's a mixture of lockdown and mitigation. But, finally, within more than 2 months, we got the virus down, and for the last 1 month, we haven't got any virus there. So, in my opinion, and China and Africa, definitely we can, work together. We share the information. We share the experience. Definitely we can do something together. I'm confident about Africa.
Dr. Gao, let's look at over the years, China's CDC has supported capacity building of the African Union's Africa CDC Center based in Addis Ababa, Ethiopia. As COVID-19 sweeps the continent, what should the new agenda for Africa cooperation in line with the agreement with Africa and China be at the CDC level?
China-Africa cooperation is under the great leadership of the President Xi Jinping, and we have all this strategic collaboration. And for the war against COVID-19, definitely we can do something together, as I said already earlier. In my opinion, seeing the future, we can do something. For example, I mentioned sharing the data, and also we have some senior advisor working together in Africa CDC with Dr. John Kangaso, and we also have at least some attaché in some African countries' embassy. One of my colleagues, Dr. Ni Daxin, he's working in Zambia, and he's working very closely with Zambia CDC. So they are working so close that Dr. Ni Daxin helped the Zambia people there and set up all these kind of strategies to tackle this COVID-19.
Dr. Gao, I know that until we have a vaccine, probably the world won't get it over with this disease. But a lot of people here in China and rest of the world are wondering when the vaccine will be available, will be fully effective. What is your take?
To develop a vaccine or specific drugs, it always takes time. So you are expecting we might be able to get a vaccine, but it takes time. It all depends, because vaccine will be used for the healthy population. You want to make sure the vaccine you are developing is safe and effective. Otherwise, can you really use a vaccine Maybe it works. You don't want the word maybe. You want to make sure it's safe, it's effective, and it really works for the people. In my opinion, the vaccine, of course, China, we are in the front line for the vaccine development. Maybe by September, we might have a vaccine to be used for emergency. For example, if we have some emergency outbreak again, you might be the new developed vaccine still under phase 2 or phase 3 clinical trials. It can be used for some special groups, for example, healthcare workers. So it all depends. In my opinion, maybe we might get a vaccine for healthy people early next year. That all depends how we are moving forward. Of course, people learn a lot from the past, so we know some of the strategies to develop vaccine will work. At the moment in China, we already have 2 vaccine candidates. They are under clinical trials. One is adeno-based recombinant vaccine. The other one is inactivated vaccine. They are under phase 2 or phase 2 clinical trials.
And Dr. Gao, a local transmission is probably the most threatening thing in Africa. Because of the logistics and financial restraints, many countries are facing difficulties in contact tracing, testing, and isolation. And they cannot afford to have lockdown like in Wuhan. So what are your suggestions for those Africans who are dealing with this kind of dilemma?
Yeah, that's really a dilemma. That's really, worries me. So once you have the patient, you have the cases in the local community, it will be very hard for you to get the virus down. So, in my opinion, from experience from Wuhan, so the most important thing, because you want to stop the sources of the infection, you also want to protect the susceptible population. You also want to stop the transmission route. So those are 3 major factors you have to take care. For isolation or quarantine for the susceptible population and for the suspected cases or confirmed cases of the isolation. So that's very important. I'm calling for all the healthy people to try to wear a mask. Wear it is very important, but very simple. So this is something I'm calling. Looking back, what we have done in Wuhan, and from the very beginning, of course, because this virus, we have so many things hidden. It's a really, I call it covered virus. We have a lot of characteristics we don't know. But once we know, this is a very special unusual virus. And in Wuhan, of course, isolation, quarantine, and treatment, they are all important, for those strategies. Non-pharmaceutical intervention, NPI, is a major strategy, including, if you are in China, the traditional Chinese herbs, Chinese medicine. It also, in some cases, it works. So this is the only thing you can do, because you don't, as you said, you don't have the vaccine, nor special drugs. So the only thing you can do, the NPI.
And Dr. Pillay, about the therapeutic response, more than 1,000 patients I know have recovered in South Africa. What are the treatment and methods of being applied in your country? And is there any special ways you're dealing with this new disease?
The world over, unfortunately, we haven't got a cure for this virus. It's a very new virus, and scientists are still working on what works. We have joined the World Health Organization's Solidarity Research Program to look at the different modalities of drugs that can be used. We are hoping through this collaborative multi-country study, we will have a better idea of what can work to cure patients. So currently the treatment is largely prophylactic. So patients are made comfortable and the symptoms are treated, but we really don't have a cure. And pretty much like Dr. Gao has said, we really are trying out different modalities to see what works. We have some ideas now of what doesn't work, like steroids, for example, don't work. So we are basically trying out various therapeutic regimens to see what works for different people. What we do know is that about 80% of people will have very mild symptoms, and for most of them, they won't need much in the way of medical treatment. There's another 20% that would need some level of hospitalization or medical treatment, and about 5–6%, based on the Chinese and other experiences, will need intensive care as well as ventilation. And that's where I think, as Dr. Gao suggested, we would need some additional support. There is not a lot of ventilators available globally. Most countries are manufacturing ventilators for themselves. So that's one of the areas that I think countries in Africa would need to invest more energy and resources, as well as in intensive care units, as well as the provision of oxygen. And I think those are the critical things that countries in Africa need to focus on to ensure that we don't have the kinds of mortalities that we saw in other countries. And that is key for us, preventing infections and decreasing the number of people who need hospitalization. And once they're in hospitalization, we need to be able to provide ventilation for those patients that need to be ventilated.
The number of confirmed cases, Dr. Pillay, in South Africa is still low when you compare to other countries around the world. Countries such as Spain, countries such as Italy, countries as the US. But in terms of our capacity and community spread, especially in more impoverished areas, how has South Africa's medical system prepared for more cases in future? Does South Africa require help from other countries? If so, what kind of help is needed?
Sophie, thanks very much for that question. We are currently preparing for what we call the surge or the peak in the number of new infections. We are currently, as you correctly pointed out, we only have about just under 3,500 confirmed COVID positive patients. We suspect that there are a lot more undiagnosed, because one of the challenges around the world is the number of patients who are asymptomatic. We are only, of course, testing currently those that are symptomatic. As we expand our testing and test those that are non-symptomatic or asymptomatic, we will clearly find more patients. The key issue is preparation, and we are using the time now to prepare in terms of the number of ventilators we need, the number of hospital beds we need, the number of ICU beds that we need, as well as preparing our health workers to try and ensure that when we see the surge, the significant increase in patients, that our health facilities are ready to both accept them as well as treat them. In terms of what we need, and we are very grateful for China, who has recently donated personal protective equipment to us. We're very grateful for the PPEs that we received from China. But let me say that there's now a global shortage of PPEs, and there's also a shortage in South Africa. So any assistance that our friends in China can provide us with respect to PPEs, as well as reagents to test people and test kits, as well as ventilators, will be highly appreciated. And I'm sure I speak for other countries in Africa who have similar needs and will have similar needs as the number of cases in Africa grow. We are expecting, Sophie, that our cases will peak sometimes late in August, early September. We don't quite know how many patients we will get, but we think they will be considerable, and that's when our hospitals will be under significant stress in terms of coping with the number of patients we have. We are already constructing field hospitals, exactly like our colleagues in China did, as well as fever clinics. We had a teleconference with our colleagues in Shanghai about 3 weeks ago to also learn from the colleagues in Shanghai on how they dealt with the surge in the number of cases in Shanghai, both in terms of mitigation of transmission, as well as testing and hospitalization, as well as how they dealt with hospitals, both in terms of the formal hospitals, the field hospitals, and the fever clinics. So we're very grateful now for the additional support we are getting through technical advice, even though it's virtual, it's remote, from our colleagues in China. the publications from China on their experiences is also helping everybody in the world, including South Africa. So we are learning quite a bit from the Chinese experience, and we'd like to thank the Chinese colleagues for that.
And Dr. Pillay, I want to ask something about communication. Of course, misinformation, fake news are the last things we want in a time of pandemic. But unfortunately, a lot of rumors being spreading around. I know there is a campaign called Listen to Experts in South Africa. Tell us more about the campaign and how frustrating and encouraging are these efforts?
So in any response to any disease, any epidemic, communication to the public is critical. And the importance of communication lies not only in the volume of communication and how often we communicate, is in what we communicate and how we communicate. South Africa is a very heterogeneous country with multiple official languages spoken in different parts of the country, and I suspect it's similar in China too, which means that we have to communicate to people at all levels of education in multiple languages and communicate as simply as possible so that people really understand the gravity of the situation, how the virus is spread, what can be done to mitigate the spread of the virus, and also what the symptoms are so that people identify themselves as COVID symptomatic and go and get tested. So these are all things that we have a very strong campaign around, and we are using a multiplicity of channels to communicate, newspapers, social media, as well as television and radio, as the main means of communication. We are also communicating, obviously, through our leaders, led by the President. And I think the South African community has really appreciated the updates from our President that he uses the television media and the radio media to communicate to the populace. So we are really stressing the importance of communication at all levels of society, but providing credible information, because as you said, there's a lot of misinformation and false information being provided, and it's very important for people to have scientifically based, evidence-based information on which to base their responses to this virus.
Well, Dr. Gao and Dr. Pillay, I have a last question to ask. As we work together as people of the world, we have to be upfront in terms of sharing information. How can we ensure that all countries are able to share proper information, correct information in time, so that countries can be able to prepare and deal with this problem? Or one can say to be frank about what's happening and the impact of this pandemic around the world. How do we share information in an honest manner?
Sophie, I think this is very important. You must be frank, you must be honest to share the data, to share the information. Like Dr. Pillay already mentioned about sharing the information not only for the countries, between countries or among countries, but also for the experts and the public. You know, if you have the wrong information, misinformation, or you have rumors, that those mixed up, you'll have an infodemic. That's a very good word, infodemic. So that's very important. I think, in my opinion, we should work together under the great leadership of World Health Organization. So this organization, we should work together under their leadership and to share the data and through the WHO. And also we can do some bilateral data sharing, like like now we are talking to each other to make sure you get always, though it's virtual, but you will get all the experience, all the data from us. I agree, keep everything transparent, take everything open, are very, very important to tackle this COVID-19. Thank you.
I want to pin you down on this, Dr. Gao. Some people might say there is a balance between efficiency and accuracy of information. For example, when should the CDC announce the urgency of this problem to the world? Based on what kind of data should they be doing that? Is there anything that you think we should revisit this time?
Well, you are working on this is a public health issue. So you don't want to give the wrong information. You don't want to give something is not confirmed. So I think the same for China CDC and the US CDC. So I mean, because I talked to Dr. Robert Redfield, earlier when we even had this outbreak. We share the information. We share the experience we worked in the field. So in my opinion, I mean, you have to share the information is confirmed. So for all these public health, first, all the information must be science-based. And then whatever information you release, you want to make sure the public would understand. You also want the public to be involved for whatever information you give. And more importantly, when you collect the public understanding, public involvement, and plus a science-based strategy, and then you will come up with some decisions. For the decision makers, they must collect all those data together, and then you will have a conclusion.
And Dr. Pillay, what do you think China can share with African countries in terms of how to deal with this COVID-19, and how do you see the end game will be like?
So as Dr. Gao says, China has the benefit of, and of course the misfortune of being the first country in the world to have to deal with the virus. They, in a sense, discovered the virus. They've had to deal with the implications of the virus, both the economic implications of the virus, the social and cultural implications of the virus, as well as, of course, the health implications of the virus. So they've got a head start of all of us. So there's lots we can learn from our colleagues in China. And of course, China has a reputation and has a long experience of helping colleagues in Africa. So there is a footprint in Africa. They've been helping, as Sophie mentioned as well, the African CDC. So we expect an ongoing collaboration from our colleagues in China on social, economic, cultural, and health-related aspects of dealing with the COVID virus, as well as dealing with the reconstruction not only of the African economy and the African social matrix post-COVID, but I think China has also a role to play in the rest of the world. And as Dr. Gao says, we have to all work through the World Health Organization, including the African Regional Office of the World Health Organization, and strengthen these multilateral organizations, because I think as we've come to realize with either Ebola, HIV, or now COVID, the world is a very small place actually, and these viruses can travel very far and very fast.
Well, thank you for your time, Dr. Gao and Dr. Pillay. And also, I want to extend my gratitude to our colleagues in China who have arranged this important joint broadcast. Thank you.
Thank you, Sophie. And thank you, Dr. Gao, and thank you, Mr. Pillay, and also thank you, Sophie, for this wonderful talk. We've been working with the South African Broadcasting Corporation on this special broadcast on how to deal with COVID-19. I'm Zou Yue. Goodbye.